And, I'm excited about any therapy that's offered for patients that suffer with Parkinson's. I think one of the hardest parts about Parkinson's, especially as the disease goes on, is how unpredictable it is. So, people don't like to make plans. They're not sure, what they're going to be able to do that day because their responses to the medication become unreliable. And so they have very good days and very bad days. And, they have time where they're on medication, where they're able to do things, and time where they're off medication, where really they can't do much of anything. So why I'm excited about this therapy is because it reduces that time off medications so that people can really improve their quality of life by being even and being able to commit to doing things and, have some predictability around life. So the idea here is that people get a constant infusion of medication. And so, they don't have to wait for a medication to hit steady state. And instead, they're at that steady state level all the time. Right now, this is approved for patients with moderate and severe Parkinson's. And, some of those patients have the biggest impact on their quality of life. So to be able to keep them at that steady state level, I think will improve that. And, it also helps balance out all the other symptoms of Parkinson's. So, I think when we think about Parkinson's, we think about the things that we can see, the tremor, or the slowness, or the stiffness. But there's a whole set of symptoms that we can't see that people are feeling, like pain and constipation and urinary difficulties. And to be able to, treat all those things as well, I think will be really meaningful for people because, having those motor and non-motor symptoms addressed is essential. One of the things that is really troublesome is these times off medication. And so the fact that this therapy reduces those off times, I think is something that has an impact to people. Sometimes you see statistics and you say, oh, like it's this much better than placebo, but off time is really one of those things that makes a dramatic impact. So I think that's exciting. There are some side effects with the medication, like with any medication. So, people may have some nausea and, I think, rash. Anytime you have like a device, you can have all the things that go along with, wearing a device and having that problem. So people do have to make sure that they can tolerate those side effects. I am excited because like the previous iteration of these devices was, administering drugs through the stomach. And, that was a little bit messy and hard for patients to use. And so this is much more like, the therapies available for diabetics or people with diabetes. And, this is something that we now have all that literature to show that, this is something people can do and can tolerate pretty well. I think whenever you're prescribing a therapy, especially something that is device related, it is important that, patients kind of have a holistic view at all their options. Is there another oral medication that would work better than having a device? And, can they tolerate that? On the flip side, we have some very good surgical therapies for Parkinson's that improve quality of life, like deep brain stimulation or focused ultrasound. And, is that the better option? So I think what's important is that patients see a movement disorder neurologist to go over, what their options are so that they can be empowered to make the best decision for them.